During the transport, her JVD got much worse. As her JVD was getting worse, the amplitude of her EKG was getting smaller and smaller. What do hypotension and JVD indicate? Pericardial tamponade. That's Beck's triad. Hypotension, JVD, and muffled heart tones. I didn't listen to her heart tones. Also, suspicious of pericardial tamponade is narrowed pulse pressure, which is where the systolic and the diastolic are awfully close together. And she had this. In one of her blood pressure readings, the systolic and diastolic were only 13 millimeters of mercury apart. And that is because a tamponade causes an inability for the heart to relax and fill with blood. So the heart's pressure at rest is going to be pretty damn close to the same pressure when it's contracting. Low amplitude QRS complexes can also be caused by pericardial tamponade because there's this big collection of fluid, or blood in her case, covering the heart. You can also get what is called electrical alternans, which she did not have. This lady did indeed have a ruptured aorta. She had dissected, she sprung a leak, and she was pouring blood into her chest, including her pericardial space. Patients commonly develop cardiac tamponade and left-sided pleural effusions. Citation in the show notes, Tiskubi and Okita 2017. Cardiac tamponade is a common fatal complication of type A. That is a dissection that involves the arch. Type B does not involve the arch. That would be called a descending aortic dissection. But cardiac tamponade, common fatal complication of type A dissection because the aorta dissects into the pericardial space. There are 8 to 31% incidence of tamponade in type A dissection, and they write that many of these patients die before reaching the hospital. In-hospital mortality is 54%. So the fact that this lady survived the transport is a miracle in of itself.